Hi, my name is Natasha, and I'm a registered nurse and nurse entrepreneur. I am the CEO of IKRN, a care management company based out of New York that partners with healthcare providers to deliver comprehensive care management services to their eligible patients living with chronic health conditions. My guest today is Shemika, who is an adult and geriatric nurse practitioner who also has her own chronic care management company. Shemika, tell us more about yourself and your background.
Good morning. Good morning. So I am Shemika. I'm a board certified adult and gerontology nurse practitioner, like Latasha just said. I own True Care Telehealth and House Calls practice. We are a chronic care management specialty practice here in California. We offer value-based services under the CCM umbrella, which includes chronic care management, remote patient monitoring, transitional care management, behavioral health integration, and then annual wellness examinations or annual wellness visits to get the patient qualified for the value-based programs, chronic care management value-based programs. We also have a obesity management program. That's what I started off with. Obesity is the greatest chronic disease of all times. I actually believe it's the mother of all other chronic diseases. So we also have an obesity management program, and I'm preparing to take the examination for the Obesity Medicine Association certification so I could be a certified obesity management specialist. We also have a line of natural supplements, and we do prescription weight loss medication. We started in March 2021, and we're going on our 2-year anniversary in March.
Congratulations.
Thank you.
So today we will be talking about hypertension or high blood pressure and how nurse care managers can help individuals manage this chronic health condition. So what is hypertension? Hypertension or high blood pressure is blood pressure that is higher than normal. The blood pressure is the pressure of blood pushing against the walls of your arteries, and your arteries carry blood from your heart to other parts of your body. So if your blood pressure stays high for a long time, it can damage your heart. So what is normal blood pressure versus high blood pressure? According to the American College of Cardiology and the American Heart Association, they divide the blood pressure into 4 general categories. So normal blood pressure normally runs 120/80 or lower. Elevated blood pressure, your top number, or what's called the systolic blood pressure, ranges from 120 to 129, and the bottom number, it would be below, not above 80. And then with stage 1 hypertension, the top number ranges from 130 to 139, or the bottom number is between 80 and 89. With stage 2 hypertension or high blood pressure, your top number is 140 or higher, or the bottom number is 90 or higher. Blood pressure that is higher than 180/120 is considered a hypertensive crisis and it's an emergency, and you should seek medical help if your blood pressure is that high. So Shemika, now that we know the definition of hypertension and the general ranges for blood pressure, do you feel like hypertension is a gateway disease, and why?
I do. Hypertension, well, actually, we all know that hypertension is a gateway disease. Hypertension leads to so many other things. The most common thing we hear is stroke, right? CDA. If you have high blood pressure, then you're going to have a stroke. But that's the most common thing that we hear. But the most common disease process that happens in the beginning when you have hypertension is kidney disease. It affects your kidneys so bad, and it can go from stage 1 chronic kidney disease to stage 5, which is full-blown end-stage renal disease, and then leading to dialysis. First off, we call hypertension the silent killer. And the reason we call hypertension the silent killer is because you don't know that you have hypertension until something awful happens, right? You end up in the hospital, you've had a stroke, or you go to your doctor's appointment and they're telling you your GFR, which is glomerular filtration rate, which is the rate that your kidneys are filtering the toxins and things that are going in, is significantly low. So you have chronic kidney disease, whatever stage 1, 2, 3, right? That's when you know that your blood pressure is higher. You go to your doctor and your doctor checks your blood pressure and it's elevated. It could be for different reasons, but if they check it 2 times in a row within 10 minutes and it's still elevated, they're going to diagnose you with hypertension. And remember, hypertension is a forever diagnosis. Once you're diagnosed, right, you're diagnosed forever. It doesn't go away. What it does, you manage it into submission. So your question was, is it a gateway drug? Is it a gateway disease? Yes, it is. I'm saying gateway drug because we know that's where we know that term from. There's a lot of gateway drugs out there. But hypertension is a gateway disease. It causes kidney failure. Excessive pressure can harden the arteries, decreasing the flow of blood of oxygen to the heart. And this elevated pressure reduces the flow of blood and causes angina, which is chest pain, which people often, which is a gateway. Hypertension leads into angina, which is chest pain, which a lot of people mistake for, I have, what is it? Gas.
Less gas, yeah.
I have gas, right? Heart attacks, which occurs when the blood supply to the heart is blocked. Heart failure, which occurs when the heart cannot pump enough blood and oxygen to other vital organs. What happens in hypertension is the blood vessels constrict, so they close. So the blood is not enough blood is not getting through the vessels to nourish all of your organs with oxygenated blood. No oxygen, what happens? We die, right? Same thing for your organs. Your organs don't get enough oxygenated blood, they're gonna die. That's why the kidneys go so fast. And then irregular heartbeat, which can lead to sudden death. And those irregular heartbeats, a lot of times people go to the doctor and they're diagnosed with AFib, right? And AFib, they're diagnosed with AFib and they're given blood thinners. And they don't understand that, and I get a lot of patients that don't understand that those irregular heartbeats, that if your heart is not lumped up, that out of control sequence will cause your heart to say, forget this and stop. And when your heart stops, you die.
Exactly.
Period, right? So here in California, about 51.2% of people 65 and older have hypertension, and they really don't know that they have hypertension. They do know that something is going on because they'll say something to you like, I've been having a headache. Or they'll say, my vision been blurry, but I don't know, you know, or you look at them. Have you ever looked at a person, Natasha, and their eyes are bloodshot? Their eyes are so red. Their skin is like nice and brown, nice and dark, and their eyes are bloodshot. If you check their blood pressure, it'll blow you away. So those are things that hypertension lead into. I think I kind of gave you symptoms and I gave you the gateway drugs. You get my point.
Okay. So some of the causes of hypertension. So there are 2 main types of high blood pressure or hypertension. There's primary hypertension, which is also called essential hypertension. And for most adults, there's no identifiable cause of high blood pressure. So this type of blood pressure is what we call primary hypertension or essential hypertension. It tends to develop gradually over many years. Plaque builds up in the arteries, and this increases your risk of high blood pressure. Secondary hypertension, this type of blood pressure is caused by an underlying condition. It tends to appear suddenly and causes higher blood pressure than does the primary hypertension. Some conditions and medicines that can lead to secondary hypertension include blood vessel problems at birth, pregnancy. Some medications as well can cause you to get high blood pressure. I know that I have taken cough medicine and I developed hypertension during my pregnancy. And when I checked my blood pressure taking that cough medicine, my blood pressure was very high. It was like,
Yeah.
160s, 170s. It was pretty bad.
Whoa.
It was very high. That's
Yeah.
how bad it was. And like you were saying, the silent killer, I was on one medication for my blood pressure and I was feeling fine. But as a nurse, I check my blood pressure, not every day, but I check it every so often. And as I was checking, I kept running 150s, 160s, and I was like, wait, and I'm already taking one medication. So then I had to go back to my doctor and
And
they
it was still that high with taking the
even,
medication?
yeah, even taking medication. So I had to have another medication added. But that was after years of taking that one medication. That one medication was managing it for a while. My blood pressure was fine,
Yeah.
but then all of a sudden I had to move. I had a lot going on, so I don't know what triggered it. But then as I was checking, I had no symptoms at all. Like you said, no symptoms. I was feeling fine. But I just checked it and I was like, wait, this keeps staying high. So I was like, let me go. And so of course she added another medication to my regimen. So sometimes just going in for your health checkup is when you would identify that you have, they would identify that you have high blood pressure. And so, like Shemika said, there usually no warning signs, and many people don't know that they have it. They might have, like you said, headaches or chest pain, maybe blurred vision. They might have a nosebleed sometimes, but
Yeah.
they're not specific symptoms. So something doesn't really happen until it's like really very high and then
Horrible.
it's
Right.
really, really late. So
Right.
measuring your blood pressure is the only way to know whether you have high blood pressure. And high blood pressure is more common in African American and Hispanic adults than in white or Asian adults. And compared with other racial or ethnic groups, African Americans tend to have higher blood pressure and get high blood pressure earlier in life. And we know as during pregnancy, African American women are more likely than white women to develop preeclampsia, which is very high blood pressure that develops during pregnancy, and then they tend to have the complications. So, Shamika, let's talk about how a CCM program can help a patient improve and manage their hypertension and avoid some of the emergencies that go along with prolonged unmanaged high blood pressure.
It is super important. This subject is so right on time. I was just on the phone before I got on with my friend. Her dad just had a stroke this morning, right?
Oh.
So in the United States, well, not in the United States, in California alone, like I just told you, 51%, 51%, half of the people 65 and older are diagnosed with hypertension. Those are the people that are diagnosed.
Right.
51%. We're not talking about the ones that are walking around, like you just said, don't even know that they have it. That's a lot of people. This is a very, very important conversation, right? So after a patient is identified and diagnosed with hypertension, it's important for the care manager to assess their personal care routine, right? So we have care paths. I've created a lot of care paths off of, I told you I worked as a director of nursing services for a lot of years, and I collected thousands and created hundreds of care plans for every diagnosis, care plans. So I took those care plans and I've been working on changing them from care plans, how we use them, to care paths, right? For the care managers. So I'm going to give you how a care management program, chronic care management program, will manage a patient with hypertension.
Okay.
So again, after a patient is identified and diagnosed with hypertension, it's important for the care manager to assess their personal care routine. Do they smoke? What is their diet like? How tall are they? How much do they weigh? Do they exercise? Are they on medication? How long have they been diagnosed? And on average, how often do you check your blood pressure? Because most people who have hypertension and take medication, don't check their blood pressure every single day.
No, we don't. I'm proof.
That I'm proof.
Yeah.
And you really should. So the care manager have care paths for the most common diseases, and hypertension happens to be one of the most common diseases.
Mhm.
So you're going to review if they monitor their blood pressure, provide support when the BP is 150/90 and greater, discuss their lifestyle, their diet, exercise. Are they on the DASH diet? Are they on the Mediterranean diet? Are they vegan? Do they exercise? Do they walk for 30 minutes a day? Their medication, is it showing any symptoms? This is where you discuss the headaches, the blurred vision. Like we have to, us as care managers, us as nurse practitioners, nurses, we have to know what those symptoms are, because you have to know what to ask the person. So this is where you're asking them, are you having blurred vision, nausea, red eyes? How do you feel after you take the medication? When you stand up, are you feeling dizzy, lightheaded? If their blood pressure is over, and I'm going point by point, if their blood pressure is over 150/90, then within our system, we have a cardiovascular risk assessment. And that's where we go. We use the cardiovascular risk assessment and then let the patient know what their 10-year risk is if they keep on this path. I believe in being 100% raw and honest with my patients, because if I sugarcoat it, you're not going to get it. And I've had people tell me a dozen times, Shemika, you just like, whoa, you're just giving it too rough. No, I'm not giving it too rough. I'm giving it just like it is. You are at risk for sudden death. Okay, if you don't change this lifestyle. So the cardiovascular risk assessment will let us know that. That's in pre-bounce. For people who use home blood pressure monitor, we need to provide training and advice on using the home monitors, the information. Let them know that you need to check your blood pressure every day before you take the medication, because what we're doing is we're trying to establish a baseline. We need to know our own BP baseline, because if you know your baseline, if it goes up too high or down too low, you automatically know, and you know what to do. And then if after 30 days we're not reaching the target BP, then we need to start the patient on remote patient monitoring. Talk to the doctor about remote patient monitor. Get them consented, explain the program, explain, express, educate on the importance of checking their BP every day. And this is why anyone with a chronic disease should have care management, should have a chronic care management program, managing them, overseeing them. Because what we do, care management, is actually preventative care. It's preventative health. We prevent things from happening before they turn into emergency room visits. So that's what we do as care managers for the patient. It takes a little bit more than 20 minutes sometimes, but we make it happen and make sure that they're not having a stroke or no awful event that's going to land them in a hospital bed.
Yeah, and one of the things as a care manager, or maybe doctors, they don't have the time to break this down for the patient to really understand. They're running from patient to patient, back to back, following up with so much. And now with so much more people with chronic illnesses and all of that, they have even less time. So that is where we fill in that gap and break this down for the patient. Okay, this is high blood pressure. If you have hypertension, understand what this is. Understand how we can help you manage this. Understand what you can do to help manage this and avoid complications. So like Shemika said, hypertension is a chronic disease that affects millions of Americans. And it's also known as the silent killer because there are no symptoms associated with this condition oftentimes. And so it's important to maintain a heart healthy lifestyle, choose foods that are low in sodium or low in salt, and that are rich in potassium. Eat your fruits and vegetables that are high in potassium. Include your whole grains and protein-rich foods. Also, Shemika talked about the DASH diet, which is a dietary approach to stop hypertension eating plan. It requires no special foods, but it provides daily and weekly nutritional goals and recommends eating vegetable, fruits, and whole grains, which includes fat-free or low-fat dairy products, fish, poultry, beans, nuts, and limiting foods that are high in saturated fats, such as fatty meats or full-fat dairy products, and limiting your sweetened sugar beverages like sodas and sweets, avoiding alcohol, getting regular physical activity, like Shemika said, making sure you get some exercise in at least 30 minutes 3 times a week. Aim for a healthy weight because obesity, of course, we know is a contributor to high blood pressure. If you smoke, quit smoking because the smoking continues to constrict those blood vessels and lead to even higher blood pressure. Manage your stress and get enough good quality sleep. So Shemika, do you have anything else that you would like to add?
Yeah, I was talking to my mom the other day and I was telling her we talk about a lot of things, and we were talking about the subject of, my mom is a Christian.
Mm-hmm.
So she was just talking about the subject of being in a relationship outside of marriage.
Mm-hmm.
And I told her, like, you guys tell us all the time, don't do this and don't do that and don't do this, but you never tell us why. And
Mm-hmm.
when you don't tell a person why, you kind of rob them, because a lot of times
Right.
they're going to do it. They don't know the reason why not. So I want to say this.
Okay.
Walking. It's so important for people with high blood pressure and with diabetes to walk. Let me tell you why. When you walk, what happens is your vessels dilate, meaning they open to give the blood an opportunity to whoosh through. You need to have enough potassium because potassium helps your vessels to dilate, to open as much as they can. And it allows the blood to whoosh through, which causes the blood pressure to automatically lower because your vessels are opening up. They're no longer constricted, right? When you walk and you're diabetic, what happens is your muscles snatch the sugar out of the bloodstream and uses it for energy. So your blood sugar automatically goes down. So those are two great reasons to walk. I had my ex-husband used to tell me all the time, walking don't help me. It doesn't help me. It does nothing for me. Like, I'm not losing weight. Well, walking is not just to lose weight. Walking does so much more for your body. So if you have legs and they work, use them before you don't have them anymore, because we know over time, these are progressive diseases. Hypertension is progressive. Diabetes is progressive. Over time, they get worse. And the first thing that suffer is your lower extremities because lack of blood, because your blood have to go down. And a lot of times, lack of blood down there, you hit your feet on a table or something, you get a little microscopic tear, it turns into a big sore. Next thing you know, you got to get amputation and you don't have legs no more. So while you have your legs, walk. When you walk, it causes your vessels to open, dilate, making your blood pressure go down. When you walk, it causes your muscles to snatch sugar out of the bloodstream and use it for energy, making your blood sugar go down. So those are two great reasons outside of the I need to lose weight. Like, I'm walking right now because I need to lose weight, you know what I'm saying? But I also enjoy the benefit of, after I walk, I like to check my blood pressure and yesterday I checked my blood pressure. It was like 170. Plus we're doing this. It was like 117 over 72. I was like, so walk. That's the first thing. And then last but not least, chronic care management is, like I said before, it's an umbrella term for value-based services that we offer patients every day in our day-to-day nursing. We do this every single day, all day. I've been providing chronic care management for 26 years, every single day, all day. Medicare said that this model works. They see that it works. It works so much that in January of 2022, they increased the rates and they increased them significantly. So Medicare set aside funds and said, I'm going to allow you guys to work to keep the patients out of the emergency room, out of urgent care, and out of these long-term nursing home stays by implementing the same measures that you do inside of the facility in the community for the patients to keep them in their home, to help them age well at home, right? If you're looking to manage your own group of seniors with high standards, then I'm going to say it again. And you need to get in contact with Natasha. She has an awesome program. I went through it. I love your program, Natasha. I really do. I'm telling you, it's great. It covers everything. She has an awesome program. It covers everything. It'll get you set on your way. And happy holidays.
Thank you so much, Shemika. So thank you again, always for your time, your, just your knowledge. I truly appreciate it. And I actually wanted to ask one more question. And this is for me personally, as someone with hypertension, because, I remember going in to my doctor, and I was having some swelling in my ankles, and stuff, off and on, but I think I had just gotten back from a trip I took, a couple hours. I didn't wear my compression stockings, which help with that, And so what sometimes causes like maybe the swelling in the legs when you have high blood pressure, hypertension?
It's the sodium. So that's just fluid in the interstitial spaces, and it's just pooling to the bottom. It's just gravity is pulling it down there, and your legs are just swollen because of that. So it's fluid in those spaces. But you were on a flight. On the flight, you got to put on those compressions.
You do. And so I do encourage you. I did notice a difference when I wore the compression stockings. They definitely help as well with managing the swelling that comes with hypertension. And one other thing, I know a lot of people, when they go to the doctor, they're diagnosed with hypertension. The doctor puts them on what we call a water pill. So they start them with a water pill most of the time. Is that accurate? I know there are a lot of different types of blood pressure medication. They do different things. Are you able to just speak a little on that before we go?
Yeah, there's several medications to treat hypertension, right? If you are African American, most African Americans are allergic to the ACE inhibitors, which is the lisinopril, stuff like that. They'll ask you if you're allergic. Of course, you're not going to know because you've never taken it before. So you just got to go by symptomology, by what you feel. So initially, when you're diagnosed with hypertension, high blood pressure, they'll give you a thiazide, hydrochlorothiazide, which is the water pill, and lisinopril. But they initially just start you off with that hydrochlorothiazide in hopes of, the guidelines say, you give the patient a water pill, and then you educate them, the DASH diet, the walk-in, the change of lifestyle, and then you give them, you're supposed to give them 30 days to adjust to that, and then you remonitor, and you just keep remonitoring until they get to whatever the goal is. But the first line of medications for hypertension is thiazides, like you said, the water pills, and then the second is the lisinopril, and then after lisinopril, it's the ARBs, the angiotensin receptor blocker, like the TANs, losartan, valsartan, and then the calcium channel blockers, amlodipine, diltiazem. I used to like to say that. I used to tease the nurses with that. Diltiazem, verapamil, amphetamine, procardia. Those are oldies but goodies. That's what I was telling you about on the last live we did. I don't see a lot of these anymore. I see a lot of the new age medications. And it's probably because of what you said earlier. You were on that medication for a while. Your body became adjusted to it. So it was time to change. That's another thing that we should be doing, kind of asking the patient, how long have they been on this medication?
Right.
Because we know that the body is a phenomenal piece of artwork, and it will, what's the word? It will accommodate anything.
Right. Yeah.
It will become immune to it. Right. So we know that if a patient has been on a medication for a long time, you got to check in because maybe the medication just needs to be changed. So those are the most common medications: the water pill, the thiazide first, the lisinopril second, and then after that, it's other medications. And they're old school to me. There's new school ones, but these are the ones that I've seen the most.
Yeah, those are the ones I'm used to seeing as well, over my years of nursing. So again, like I was saying, thank you so much. I just wanted to add that additional information in there. So thank you everyone for listening. If you want to learn more about chronic care management, of course, hit the like button and subscribe to my YouTube channel for more informative videos with myself and Shemika. Click the link below if you'd like to learn more about my chronic care management for nurses online course or to schedule a consultation with me. Shemika is based out of California and I am in New York, so we're on either side, but we definitely connected. And if you'd like to learn more about the services she provides, I will add her link and how you can connect her below as well. So thank you everyone and have a great day.
Bye.
Thank you, Shemika.
You're welcome. Bye.